Everybody have your water handy. Hydrate. Hydration.
It's so important.
So we'll do about another minute.
Got a couple more trickling in. You'll get a little glimpse of our clinic space behind us.
We don't have to use these books when we're treating patients. Only after they leave. New Orleans time, we do run a few minutes late here sometimes.
Always.
So for our New Orleans participants, we're giving you a little cushion. All right, y'all, we are going to get started.
Yay.
Welcome to our Core and Pelvic Floor webinar series. We are so happy all of you are here to join us. And just remember that if you are not in our live version, it's okay. You can catch us in the recorded version at any time. That will be emailed out to everyone. Okay, so we have a little bit of housekeeping first. We want to tell you how to be the best participant ever.
So everyone, we kind of already tried to mute everyone, but just make sure your mics are muted. We're not hearing anyone come through, so that might already be taken care of. But that way everyone's not hearing everyone's background sound. There's a Q&A option, so if you'll have any questions at any point, just type them into us. They're coming to us privately, so no one else will see what you're asking if you want to ask a more personal question. And we're going to actually take a break about halfway through to answer a few questions, and then at the very end, we'll kind of finish up with questions as well. Make sure you also have everything else closed down on your computer. Make sure you're not running a bunch of programs or have a bunch of tabs open like Kelly and I always do on our internet. It might just slow it down for you on your end as we're kind of running through some of the video and things like that. So yeah.
And you should have all received an email from us with course materials for week 1. In that email, you have a handout for tonight. These are just the PowerPoint slides. So it's a PDF file. You can print that out if you didn't already. If you are a note taker like we are, then you already have it in hand with a pen ready to go. If not, just know that they're available for you, and you can make a little folder if you want for all 4 weeks, so you have all the information packed into one place. On that email also is a breathing audio file. That's part of your homework. So your homework actually this week is so nice because it is breathing.
It's relaxing.
It's
very calming.
We're telling you that you have to set aside time to relax.
Yes.
It's only a 5-minute file, so everybody can find 5 minutes.
For sure.
Especially at the end of the day, that's when I find a little bit of time to relax before I go to sleep.
Yeah.
So that guided breathing practice is meant to calm your nervous system and allow the diaphragm to kick in. So check that out for your daily homework. Not too much to ask. And then just make sure that you have a little setup for tonight while you're with us doing the exercises. Pull in your yoga mat, a pillow. We will allow you a few minutes to set up too as we go. We'll walk you through it. But just so you're not running around your house collecting your materials, if you want to now, grab that so you can be ready for us. Our question and answer during this format, we want to make it as interactive as possible. So please ask us questions, any and all questions. And again, like Christina was saying, nobody else can see them. So we'll get to that 2 segments during the webinar to answer the Q&A. Some of our slides are pre-recorded, so you will see us pop in and out a little bit. So we'll join you and you can see our faces. And then on the pre-recorded slides, we will not be here making funny faces
visibly. We'll be here, you just won't be able to see us.
Okay, so here we go.
So for those of you that I may not know, I am Dr. Christina Melandris. I'm a physical therapist with Kelly at HandsOn Health.
And I'm Dr. Kelly Bernard. I started HandsOn Health 2 years ago. It was my mission to deliver quality care in a one-on-one format to my patients. I had worked in busy clinics before. I got really tired of delivering lower quality care. And so I started to go into my patients' homes and see them one-on-one. And I've loved it every day since. We now have a clinic location in Old Metairie. So we're both on the road in our patients' homes and in our clinic space. And this is our new direction of growth, is getting online to educate wider bases of our population. We realize that a lot of things that we are teaching our patients are in general things about wellness, posture, breath, core. So we started to put those things together, and this is our first run through of that. So we're so happy to have you here for week 1.
Yes, thank you all for joining us. We're excited. Are y'all ready?
Here we go.
All right.
Okay, so I'm going to walk you through our webinar outline of the course from beginning to end. Tonight is Module 1. We're going to introduce the muscles of the core and pelvic exercises that will help with your diaphragm breathing. This is the foundation that we're going to build on. As we move into Module 2, the core is the focus for the second week. We're going to hit on muscles again related to pelvic floor. What is your core? Understanding those practical exercises that will help carry you through to week 3. As you continue exercising, you're going to be learning more then about your glutes, your hips, lumbopelvic complex. This is where we're going to talk about low back pain and how that relates to your pelvic floor. And then finally, week 4, as we wrap it all up, we're going to get really deep into the pelvic floor, its muscles, its function. We're going to teach you how to do Kegels. We are going to really tie that all together. And hopefully you were able to sign up for our live class to meet us on the 5th week in the clinic in Old Metairie, where we are going to put it all together live.
So we are so excited to kick off week 1, which is going to be Module 1 this week. We're going to start this week with an anatomy overview, which we're going to do every week, just to give you a visual on some of the topics that we're going to be discussing. So then we're going to move into kind of a general overview on the core muscles and the core function, because when we get to week 2 next week, we're going to dive a lot deeper into some of that information. But this week is really focused on the role of breathing and how all these muscles function together, and the role of the diaphragm. So that's going to lead us into teaching you how to engage your diaphragm properly for breathing, and teaching you a few other exercises that are going to give you better control of your breath. So let's get started. So a good way to visually think about the core is as a functional cylinder. So again, the diaphragm's kind of the top of that cylinder, or the ceiling. You have that big transverse abdominis muscle that actually starts in the front and wraps all the way around to the spine. You have your multifidus muscle that runs up and down along the spine, that functions as the back end, and your pelvic floor muscles, which function as the literal floor of your core. So, you know, when we think about the core, it's really a puzzle with a lot of pieces. It's important that all these muscles communicate and work well together. And as we kind of work through each week, you're going to see that if there's kind of breakdown in one area, that's going to affect kind of every other part of this core system. Things are very complex. So we're just, again, giving you a general overview of what you're going to be going further into more detail with each week as we progress through the layers of the core.
So here's our anatomy view from the side. You can see how large the transverse abdominis is. This is that really deep core stability that we rely on in order to do heavy lifting, pulling, pushing, stair climbing. We get a lot of stability from contracting our transverse ab muscle. And then the multifidus in the back on the left side, you can see how it's thin, vertical. It connects one segment to the next up and down the spine like dominoes, the multifidus provides a very important role of stability in the spine. And then you can also see how the pelvic floor is shaped like a hammock here. Its muscular attachments really provide that floor of stability for our movements for squatting, running, walking. It ties the front to the back, and it ties everything upward and inward, keeping it all stable. And then you can see the diaphragm at the top, shaped like a dome. This diaphragm ceiling in this picture is shown at rest. So whenever you take a breath in, we'll go into this a little bit later, that diaphragm muscle descends and that C curve goes downward. And we'll look at that more in depth as we understand more of the mechanics of breathing with your pelvic floor. On the right side, we're going to take you through the layers here. So you can see the cutaway of the muscular layers of your abdomen, beginning with the rectus abdominis. So there's your six-pack muscle group right there. Rectus abdominis is the first layer. And then we dive a little deeper, external obliques. That's like the side wall of your core, down into the internal obliques. External and internal obliques have a lot to do with rotational stability, connecting that rib cage into the side wall of your body and providing that side support left and right. And then the deepest layer you can see stripped away under all three of those other layers is the transverse abdominis. So when we are evaluating a patient in therapy, we are looking not at whether you have a six-pack or not, we really could care less. But your transverse abdominis is such an important muscle group for that deep core stability to provide spinal health, pelvic floor health, and everything you need to really functionally move about your day. And many, many patients do not have that transverse abdominis muscle function working very properly. No matter how much you work out, sometimes you can be missing that deep core recruitment of the transverse abdominis along with internal, external obliques, those deeper layers.
So with the pelvic floor being the floor of your core, another thing to keep in mind is that it provides support for the abdominal viscera, or basically all your internal organs. Without it, gravity's pulling all of that down and really everything would kind of fall out, which actually can happen to a certain degree, but we'll touch more on that in week 4. But we're kind of just doing a general overview because as we go through each week, we're going to go a little bit deeper into each of these layers.
So here we see the 360-degree motion of our breath taking place in the rib cage and the diaphragm and the belly. When we inhale, the diaphragm muscle contracts downward towards the belly. It pulls in the air into the rib cage, into the lungs, and so the ribs flare outward and upward, allowing for all of that expansion of the chest cavity to pull that air in. Whenever you exhale, the diaphragm comes back up into its dome shape, fitting into the bottom of the lungs, and the ribs shrink back down towards the center of the body. So there's a full excursion of motion that we need in order to truly exercise our diaphragm correctly. When we have mobility restrictions in the ribs or the spine or the diaphragm or the soft tissue of the abdomen, you can see how breathing gets constricted if we have any limitations in movement here. And on the picture on the right, it just demonstrates again the pattern of breath and how it moves through the body. As you inhale, you fill your lungs with air first, and then your abdomen expands as you take that deeper breath. That's the diaphragm coming down. And then as you exhale, your abdomen contracts back upward, the diaphragm goes back up, and all of your air comes out. Let's discuss correct and incorrect breathing patterns. Many times during the day, if you tune in to the way that you're breathing, you might notice that you're breathing in a shallow manner, using mostly your chest muscles to breathe and not a lot of your diaphragm and belly motion to breathe. The correct pattern is one that is efficient. It is going to really optimize your blood flow and your oxygenation that is available to your body through the lungs. So whenever you're breathing deeply with the diaphragm, your ribs are opening up sideways, the stomach opens, you have that 360-degree full-on diaphragmatic mobility, breathing properly to really maximize blood flow and oxygen to the body, the brain, the muscles, everything you need to fuel your body through its active movement patterns in the day. Whenever you catch yourself under stress or multitasking, which, you know, honestly, we're multitasking most of our daily lives in our society, so we will catch ourselves breathing in our chest. The waist draws inward. We might be holding tension in our belly. The rib cage and the shoulders lift upward. So this is your body in an incorrect breathing pattern trying to intake oxygen without using that full capacity of the diaphragm muscle to breathe for it. We want to be able to consciously recognize our own breathing patterns more frequently through the day. So whatever you're doing, working, dealing with children, cooking, whatever your task, you want to be able to give your body a little check-in and just take a deep breath. Come out of that chest breathing pattern and down into your belly diaphragmatic breathing pattern. Through this class, learning how to connect with your breath is just major importance to learning how to operate from your core. And the breath work really serves a vital connection there, recognizing your body's response to stress and knowing how to correct it through something as simple as taking a really good diaphragmatic deep breath.
Okay, so we're going to take you on a little visual video slide. This is a chest X-ray. So right here, we're going to view the lungs as we inhale. Let me set it at the right time of the video because I want to show you right here. This is the frontal view. So this black outline is the diaphragm muscle. And the white tissue is the lungs, the air. You can see the ribs, the bones. So as you inhale, you can see the diaphragm moving down. So all of these abdominal contents are having pressure come down on them with your inhalation. And then the diaphragm moves back up, releasing the air as you expire, as you exhale. I wanted to show you the side view right here around 2 minutes. So again, from the side. So these are your rib bones, the little curved shapes here, the darker, and the lungs, and then the black outline diaphragm muscle. And look at it go. Inhale. And back to it. There we go. Inhale and exhale. So as you can see, here's that relationship between the diaphragm and the pelvic floor underneath. Your pelvic floor, even though it's not visualized right here, you can imagine what's happening on your inhalation is your abdominal contents are with pressure moving down on top of that pelvic floor.
Like that.
Yeah.
As a unit.
And so when you have pelvic floor tension, you are going to have problems in that tension system. And we'll get more into that with our pelvic floor module. But right now, I want you to really just see that relationship of how much movement goes on in our abdomen with our breath related to the pelvic floor. And as we understand this muscle tension relationship, the pelvic floor is this muscular floor. The diaphragm is the muscular ceiling. And that air pressure between the two is just vital to having it properly work. So we really can't expect one to work well without the other one working well.
And what's cool about these videos is you can see that the diaphragm is this big, I mean, from both angles, it's moving in a three-dimensional way. So it's actually, when you're taking a breath in, it's moving 60% outward, 30% towards the back, and then 10% up. So there's, I mean, you can see in this video how much movement is occurring through that pressure system and how much that muscle is actually working. So pretty cool.
We want to take this relationship of breath into our pelvic floor. So to understand this, I want you to think about this umbrella upside down. I want you to visualize it closed. That is our respiratory system at rest, the closed umbrella. As we inhale, the umbrella opens. That's our diaphragm. That blue fabric of the umbrella is literally our diaphragm opening, that 360-degree motion outward, downward, towards the lower abdomen. Our pelvic floor needs to be able to relax and lengthen its muscle tissue, its fibers, in order to allow us a full diaphragmatic breath. So as you can visualize this umbrella opening on inhale, you could see how your pelvic floor needs to be able to open and relax also, to allow all those contents of your abdomen to be gently pushed down by the diaphragm opening. When we exhale, our pelvic floor is naturally going to shorten. This is due to a lot of biomechanics that are going on between the diaphragm and the belly contents in the pelvic floor. But if you can visualize that umbrella closing up, our pelvic floor tissues are also shortening. And when we contract on an exhale, when we do a Kegel on an exhale, that efficiently works with the motion of the natural diaphragm. So opening and closing that umbrella is really a nice analogy for inhaling and exhaling. Now that we have circled around the rib cage motion, the belly motion, and how the pelvic floor reacts whenever all that's opening on inhale and closing on exhale, you can begin to put together these mechanics anatomically that allow the pelvic floor to be in a very good functional state for your exhales and your inhales. And whenever we go to retrain your pelvic floor muscles to act properly, when the breath is in place and the diaphragm can move and the pelvic floor knows how to relax, all of those working parts together help one another in relationship to full function.
Okay, hope everybody is enjoying the show so far. We have a question from an audience member. I catch myself chest breathing all the time. What can I do to breathe correctly during the day? So this is an excellent question, very relevant because it really does affect all of us.
Yes.
And that's why we're all a bunch of chest breathers, really.
Yeah.
Literally, we all do it. Christina and I teach it all day long, but we still catch ourselves doing it.
For sure.
So it's something to bring into your awareness, and that's where to begin. As you become aware, usually under states of stress, multitasking, when we are in the throes of fight or flight, our nervous system is not doing this diaphragmatic breath. We're more in action mode then. So if you can catch yourself in a stressful moment or in a multitasking work mode, and just check in with your breath. Take a deep breath then. That awareness and that change in pattern is going to lay the foundation for your brain to be able to notice the pattern. Once you notice the pattern more often, then you're laying down a new habit over time. So it's really about changing from an older habit to a newer, more efficient habit. The more you notice, the better it becomes.
Yep.
Your exercises with your breath work in this class will definitely help you engage that more often and build the new habit.
So the other exercise we got is how can I think about coordinating my breathing while I'm exercising? This we're going to go more into depth each week too, because as we kind of mentioned, we're starting at the very top. We're working our way down the layers and how all of these things function together. The major thing is while you're exercising, we all do it, especially if you're doing something new or difficult. We love to hold our breath. We're trying to exert force by bearing down. You need to keep things moving because that's going to allow that whole cylinder effect to really kick into high gear and to allow those core muscles to really engage. Generally speaking, when I tell people to, if you're going through a specific exercise, anytime you are like tensing a muscle or performing the hard part of the exercise, you should be breathing out. That's also going to help prevent you from kind of holding in and bearing down. So say you're doing like leg kicks or something. As you're straightening the leg out and contracting that muscle, that's when you want to be breathing out. And then as you kind of release and relax back to start position is when you want to take a good inhale and kind of reset, get a lot of oxygen to those muscles. But allowing that breathing mechanism to continue is going to make sure that all those core muscles are kicking into gear, and giving you that support that you need to do everything else. So
don't hold your breath.
Essentially is the most important part.
Yes.
Do we have any more questions for right now? Let's see.
Yes. Let's see. I think we're good.
Okay. So if y'all have questions, send them through, and then we're going to do another one at the end. I think we're about to start our exercise piece in a minute, but here we go.
Stay tuned.
In this picture, you see an example of us treating in the clinic. This is something we commonly do for postural issues. We'll use a mirror, we have the patient in front of the mirror, and we're training postural muscles to turn on or turn off in relationship to everyone's individual and specific issues. We're very excited to teach you these new exercises over the next few weeks, but we want to be sure that everyone is being safe and performing everything comfortably. These exercises are not meant to treat a specific diagnosis, but they are meant to promote general wellness and mobility. So if you have any concerns about a current injury you have or performing an exercise specifically, please send us a question on the Q&A and we can give you better guidance. This is no substitute for physical therapy, so if you feel like you need further evaluation, please reach out to us. We are not prescribing any exercises in this format because we have not assessed any issues that we normally would evaluate individually in a clinical scenario. So these exercises are in general for your wellness and not for any diagnosis of disease or impairment.
Okay, everyone, so we're about to begin the exercise portion. We are going to go through a few exercises with y'all. First things first, though, know that if you're breathing like this blonde person in the picture, you're definitely overdoing it. So everyone take a minute, get your yoga mats out, kind of lay them down somewhere near the computer where you can still watch the screen, hear the screen as we kind of walk y'all through these exercises. Also grab yourself a pillow to support your head. If you have a bolster or a foam roller or something that you would like to slide under your knees for more comfort while you're laying on your back, you can also grab that and get that situated. For the first exercise, you're actually going to be lying on your back. If you are unable to lie on your back for any reason, you can grab an extra pillow or two and maybe elevate or prop up your upper body on that stack of pillows so that you're in more of like a semi-reclined position as opposed to lying flat on your back. So everyone take a second, get situated, and then we're going to show you the setup on the next slide.
So for each of the exercises, we're going to show you a slide with like the setup of how you should be positioned. We'll give you a minute or two to get there, and then we're going to play the video. So then it'll walk you through everything, but just make sure y'all can still see the screen as y'all are going through this and at least hear us.
The first exercise we're going to go through with you is diaphragmatic breathing. So teaching you how to properly engage that diaphragm to ensure that you are using a proper breathing pattern and not compensating or using other muscle groups to help you with that. So you want to be lying on your back. You want a pillow or a rolled up blanket or towel or something supporting your head. If you have a bolster, pull it out, situate it under your knees, kind of take some of the pressure off that lower back. And then you want your hands on top of your belly on either side of your navel. And then we're going to begin.
All right, everyone situated?
For diaphragmatic breathing, you're going to take your hands and place them on your belly, on the left and right sides of your belly button. Relax everything in your body. Really allow all of the tension to melt away so that nothing is working. The floor is completely supporting you. You're going to begin on a deep inhale. As you inhale, blow up the belly like a balloon with your breath. So you're feeling the expansion of your abdomen with your hands, rising towards the ceiling on your inhale. Focusing on that big expansion, 360 degrees. The ribs are moving upward, sideways, and backward for the diaphragm to do its job. As you're inhaling, you're bringing the breath deep down into the sacral area, down towards the tailbone, down towards the pelvic floor. So that inhale is allowing those hands to really rise up towards the ceiling and fall down towards the spine with your exhale. As you follow this rise and fall with your hands, you're connecting more deeply with the action of the diaphragm muscle. You're allowing the pelvic floor to relax on every inhale. And for a little progression, once you get the deep inhale expansion, hands rising, and the exhale, hands falling, I want you to work on an active exhalation. So you're going to take that deep inhale, hands rise, and this time when you exhale, squeeze your belly actively, recruiting the muscles on either side of your belly button to draw them in towards the navel. The transverse abs are recruiting for exhale. So you're going to really actively press the exhale out of your body, pursing your lips like you're blowing out the candles on a birthday cake. When you exhale this way with pursed lips, you're allowing the pressure system inside your abdomen to function at an optimal level with your pelvic floor and your diaphragm. Makes the inhale a little bit easier too. So you're really expanding mobility with your inhale, hands rising up, and your exhale, hands falling back down, actively engaging the abs as you purse your lips to force all of the exhale out completely.
Here are the written steps, so you have them outlined in your handout at home. These instructions include a method to position your fingertips just below the rib cage while you're breathing, so your brain receives better feedback on what your body is doing. This is something we're going to review and practice in our live class on week 5 in the studio. But at home, be sure to use your guided audio breathing exercise that was emailed to you along with your handout so that you can train your diaphragm and pelvic floor to function properly with breath. Daily retraining and repetition is the key to getting the best outcome and functional changes.
So for the next exercise, y'all can go ahead and stay on the ground, lying down. I'm going to show you a setup slide next, but you're going to actually be on your side. So I just wanted to make sure you aren't trying to get back up and then get back down.
Let's get set up for open books. This next exercise is really going to open some of those restricted tissues that might be hanging out in your upper thoracic spine, between the shoulder blades, in the chest, in the diaphragm and rib cage area. So this exercise is great for providing that mobile and flexible foundation for good breath work and good posture too. So just like the picture, you're going to be lying on your side on your yoga mat, head supported by a pillow, bending the knees so that your feet and ankles are just about in line with your hip bones. It doesn't have to be exact. Bent knees that are comfortable, allowing your body to balance on your side, and the hips need to be stacked. So it is important that your hip bones are perpendicular to the floor. You don't want to be rotated forward or backward on that top hip, but you want it to be perpendicular to the ground. The arms are extended, elbows are straight, palms are together, just like an alligator chomp motion. And this is our beginning point.
So we're going to show you the video next, but the main thing too is if you have pain for, for any reason in any part of your spine, neck, arms, we want you to do these exercises comfortably. So don't go through a full range of motion if it hurts. Just keep it in a comfortable space. If you need a little more guidance, just send us a little question on the Q&A and we can kind of help guide you through that. These next couple of videos, we're actually going to run them twice. So we'll run them once and then I'll let you know we're doing them again, just to give y'all a chance to do a couple repetitions and get comfortable with this and get a good feel for it. All right, here we go.
So this exercise is called open books. This exercise specifically helps to improve range of motion and mobility in your upper back, which is so important in regards to breathing and also allowing good mobility of the rib cage. You're going to begin laying on your side, hands stacked on top of each other, and you're going to slowly lift your top arm and rotate it up and back. As you're doing this, you want to follow your thumb with your eyes. Go through as much of the motion as you comfortably can without pain. Ideally, you want to be able to rotate all the way back so that your hand is touching the floor on the other side. And you're going to slowly rotate it back. The key is to move through this motion nice, slow, and controlled.
Okay, so we're going to run it again so y'all can do another few repetitions of this.
So this exercise is called open books. This exercise specifically helps to improve range of motion and mobility in your upper back, which is so important in regards to breathing and also allowing good mobility of the rib cage. You're going to begin laying on your side, hands stacked on top of each other, and you're going to slowly lift your top arm and rotate it up and back. As you're doing this, you want to follow your thumb with your eyes. Go through as much of the motion as you comfortably can without pain. Ideally, you want to be able to rotate all the way back so that your hand is touching the floor on the other side. And you're going to slowly rotate it back. The key is to move through this motion nice, slow, and controlled.
So the next video is going to be the same exercise, but we're going to do it on the other side. When we teach people this exercise, it's important to do it on both sides just to kind of keep things evened out, to make sure you're working on mobility evenly on both sides of the body. So you can roll over and we'll take you through that video twice as well to give y'all a chance to run through it a few times.
So you want to perform this exercise on both sides. Go ahead and roll over onto your other side with the same setup, arms stacked on top of each other, knees bent, hips bent. So you're going to slowly lift that top arm up, rotating back and following along with your eyes as far back as you feel comfortable going. Pause for a second, and then same thing back. Bring those hands back together, rotating that spine all the way up through the neck.
All right, we're going to run it one more time.
So you want to perform this exercise on both sides. Go ahead and roll over onto your other side with the same setup, arms stacked on top of each other, knees bent, hips bent. So you're going to slowly lift that top arm up, rotating back and following along with your eyes as far back as you feel comfortable going. Pause for a second, and then same thing back. Bring those hands back together, rotating that spine all the way up through the neck.
So our next video is going to be a progression of this exercise. You can stay on that same side, or if you want to kind of reposition, just make sure you're facing the screen. And again, we'll run that one twice so you can, repeat it a few times.
To integrate the open book exercise into our breathing, we're going to learn to coordinate the two. The motion is going to be the same as in the previous video we showed you, but we're going to move through it a little bit more quickly. So as you lift your arm up and rotate to open out, you're going to take a deep breath in through that motion briefly pause, and then breathe back out and expire as you're closing it back. So we'll do another deep breath in, open and rotate, and then push that breath out as you close it back up.
All right, so y'all keep breathing and rotating.
To integrate the open book exercise into our breathing, we're going to learn to coordinate the two. The motion is going to be the same as in the previous video we showed you, but we're going to move through it a little bit more quickly. So as you lift your arm up and rotate to open out, you're going to take a deep breath in through that motion, briefly pause, and then breathe back out and expire as you're closing it back. So we'll do another deep breath in, open and rotate, and then push that breath out as you close it back up. As far as injury prevention goes, the biggest take home that we want you to get from this is the importance of maintaining a healthy core and healthy pelvic floor. As we go deeper into each week, we're going to, dive into the layers of why these factors are so important as far as support of the spine and support of the trunk, as well as function of the arms and legs. So generally speaking, if we keep good mobility and strength and activation of these muscles, it should help to prevent lower back pain and prevent, other issues that could develop in your arms and legs as well. There was actually a study done, I think out of Australia, that looked at close to 40,000 women, and they wanted to look at factors other than people's activity levels and their body mass index and how it related to the prevalence of back pain. So they wanted to look at it from a different angle. Their goal was kind of to determine if people with continence disorders or respiration disorders were more likely to develop back pain. And what they found was that women who had, disorders with continence or incontinence and had respiratory issues had a significantly higher prevalence of back pain than women who did not have these problems. And they found that disorders of breathing incontinence had a stronger association with people developing back pain or having back pain than actually obesity did. So again, as we go each week, we're going to go further into the function of these muscles and how that plays a role in the big picture of everything. But just knowing the role in overall support and stability of the spine is the most important aspect of that.
We're back. So here are some of our references. If y'all ever want to ask us, we're going to usually have them listed, but feel free to look through some of these. It's kind of a compilation of some research, some things that we've learned in classes, and things of that nature.
Okay, so we just want to review for you guys as we wrap it up. Your homework this week, just a little tiny dose. The 5-minute guided breathing practice is in your email. If you did not receive it for any reason, just reach out to us. Our contact information, you already have it in your email box, but email is pretty much the simplest, fastest way to get us during the day. And so you want to do your 5-minute guided breathing. Again, nighttime is perfect for that. It settles the nervous system, prep for sleep.
I did it right before bed the other night, and I fell asleep before it even ended. It was perfect.
Yes. So imagine that every night coming up this week, you will be set and ready. You'll be dynamite. The diaphragmatic breath that we were practicing this week in the module, you can integrate that with your guided practice. So if you have your handout printed, there is another technique in the printout, and that is where you put your fingers into the bottom of the rib cage. I'll show you real quickly. You just wrap them here, and as you're inhaling, you can feel the movement of the diaphragm in the rib cage with your diaphragmatic breath. So that is detailed in the written instructions on your handout. You can do those, again, like a 1-2 punch together. And then your open book exercise, we recommend that you try to do 10 reps 2 times a day. And I hope that y'all followed the pace of the actual exercise video, because it is slower than you would naturally want to move through it. So as you're slowing it down and you're breathing with it, you're really giving those muscles a chance to train properly with the brain. And that is where you're going to develop better habits with that, better technique and form. You'll get a lot more out of it that way. 10 reps twice a day. So if you fall off a day, that is no big deal, but do try to do some consistency with this. So if you hit 5 out of 7 days in this week, you're going to be doing great to prepare yourself for week 2.
Yes. So I think we have one more question. If anyone has any other last minute questions or anything they want to send through, we're pretty much wrapping up.
Yes, so thank you for your questions. Very thoughtful audience members. We had someone who felt a little restriction whenever they rotated back in open books and what to do. So this is a very good question, and we will individually respond to you. But what I want everyone to know who's with us, whenever you're doing any of these exercises through the entire series of 4 weeks, nothing should cause pain. So if you are hitting a range of motion that is feeling tight, restricted, you know, that tightness and restriction, that can be okay to work with. Your range of motion can loosen up with repetition, but pain is a symptom that is telling you to listen and to stop what you're doing. So you do not want to work through pain. We want to eliminate that no pain, no gain thinking.
It's a terrible saying. It's not true.
No.
Don't listen to it. Pain is your body's way of saying stop. So work into it comfortably. And like we tell our patients, you know, as you do it more, things will ease up and calm down. Your body's going to get accustomed to these new developing patterns, but just work with it, not against it.
Exactly. And all of you have us as your 2 PTs through this 4-week series. So please reach out individually, email us if you have questions that come up. And if you are local and if you are having issues that do arise, definitely reach out to us so we can actually see you if needed.
Yeah. So as Kelly mentioned, email is the easiest way to get us during the day. That's both of our emails. Feel free to send us questions. If y'all have any feedback about tonight, things that we can tweak to make better or more comfortable for y'all. You know, each week is going to be a little different. It's going to be very similar in kind of how we go about things. It's going to be a mixture of us, you know, teaching all a bunch of stuff, but also doing some exercises. Next week is the core, so get excited. It's going to be more in depth of the core muscles, how those work. We'll do some exercises that's going to engage some of those things as well. But feel free to email us with anything over the course of the next couple of weeks, or even after that if you ever have questions. We have a physical location in Old Metairie for those of you that are local. We are located inside of Crescent City Psychotherapy in Old Metairie on Sierra Court. We also do mobile appointments. So we also go to people's houses to see them for physical therapy at their homes. Follow us on social media. We're on Facebook and Instagram. We always post kind of a mixture of fun things and then like informational things and things that we're doing and updates and things of that nature. But just make sure y'all work on your homework. Each week is going to kind of build upon the one before. And for those of you that are doing the class the very last week here with us in Metairie, we're going to be putting it all together. So it's important for you to be kind of familiar with these things and be working through some of this. It's going to basically like lay down the foundation for you to have a really great time that last week. So,
yep. Stay tuned for week 2. Look out for your inbox. We will be hitting it up soon. Like us and share us on Facebook too. Spread the word.
Y'all have a good night. Thank y'all so much for joining us.
Bye.
Bye.